Okay, so good day everyone. I'm Michael Johnson, AU intern, and I'm going to discuss hydrocephalus. So hydrocephalus is a condition in which excess cerebrospinal fluid or CSF builds up within the fluid-containing cavities or ventricles of the brain, resulting pressure inside the brain. So as we can see here in the picture, we have here yung normal ventricles. Ayan, so wala siyang normal amount of CSF. While on the picture on the right, so as we can see, enlarged ventricles. So there is extra CSF. So nag-i-increase siya ng pressure. Ayan. So what are the functions of the CSF? So it acts as a shock absorber for the brain and spinal cord. It acts as a vehicle for delivering nutrients to the brain and removing waste from it, and it flows between the cranium and spine to regulate changes in pressure. So the prevalence of hydrocephalus, it can occur at any age, but is most common in infants and adults ages 60 and older. According to the National Institute of Neurological Disorders and Stroke in the US, hydrocephalus is believed to affect approximately 1 to 2 in every 1,000 children born in the US. The majority of these cases are often diagnosed before birth, at the time of delivery, or in early childhood. While in the Philippines, almost the same sa US, about 1 out of 1,000 children suffer from hydrocephalus in the Philippines. About the causes of hydrocephalus, little is understood about this, and some cases are present at birth, while others develop in childhood or adulthood. Hydrocephalus can be inherited genetically, may be associated with developmental disorders like spina bifida or encephalocele, or occur as a result of brain tumors, head injuries, hemorrhage, or disease such as meningitis. Based on onset, presence of structural defects, or high versus normal CSF pressures, hydrocephalus can be divided into categories. So we have 5 categories. One is acquired hydrocephalus. So this is a type of hydrocephalus that develops at birth or in adulthood and is typically caused by injury or disease. Congenital hydrocephalus. This is present at birth and may be caused by events that occur during fetal development or as a result of genetic abnormalities. So this happens when the baby is still inside the womb. Next is communicating hydrocephalus. This type of hydrocephalus occurs when there is no obstruction to the flow of CSF within the ventricular system. The condition arises either due to inadequate absorption or due to an abnormal increase in the quantity of CSF produced. Next is non-communication or obstructive hydrocephalus. It occurs when the flow of CSF is blocked along one of the passages connecting the ventricles, causing enlargement of the pathways upstream of the block and leading to an increased pressure within the skull. So there is blockage. Then, normal pressure hydrocephalus is a form of communicating hydrocephalus that can occur at any age, but is most common in the elderly. It is characterized by dilated ventricles with normal pressure within the spinal column. And lastly, the hydrocephalus ex vacuo. It primarily affects adults and occurs when a degenerative disease like Alzheimer's, stroke, or trauma causes damage to the brain that may cause the brain tissue to shrink. So what are the symptoms of hydrocephalus? So there are, we separated the symptoms for the infants, the children, and adolescents, and the adults. So these symptoms vary. So possible na magkaroon, pwedeng lahat o pwedeng ilan lang. So depende case to case from person to person. Okay. So for the infants, so ito yung basically usually present. Nakitang-kita natin yung unusual large head size. rapidly increasing head circumference, bulging and tense fontanelle or soft spot, prominent scalp veins, downward deviation of eyes or sunset sign, vomiting, sleepiness, irritability, and seizures. For the children and adolescents, nausea and vomiting, swelling of the optic disc or papilledema, blurred or double vision, balance and gait abnormalities, slowing or loss of developmental progress, changes in personality, inability to concentrate, fissures, poor appetite, and urinary incontinence. While for the adults, headache, nausea and vomiting, difficulty walking or gait disturbances, loss of balance or coordination, lethargy, bladder incontinence, impaired vision, impaired cognitive skills, memory loss, and mild dementia. Okay, so for the testing and diagnosis, aside from the clinical signs and symptoms, so the physician will perform thorough examination and as well as with the help of these diagnostic tools such as the CT scan or CAT scan, MRI, lumbar puncture or spinal tap, intracranial pressure monitoring, and the isotope cysternography, in which they put a radioactive, they inject a radioactive material that will go inside the brain, specifically sa ventricles, and then they took some images. Of course, in terms of monitoring the condition of the patients, neurosurgeon and neurologist most of the time is included in the treatment. Okay. So for the treatment, so we have two existing treatment for hydrocephalus. Okay. So by the way, hydrocephalus is from the Greek word hydro, which means water, and cephalus, which means head. So hindi naman siya talaga wala naman siyang technically water sa head. It's just yung CSF. So for the treatment, the shunt. So this is the most common treatment for hydrocephalus. This is the surgical insertion of a drainage system called a shunt. It consists of a long, flexible tube with a valve that keeps fluid from the brain flowing in the right direction and at the proper rate. So of course, kailangan pa rin i-balance yung CSF inside the ventricles. So proper rate lang yung draping ng CSF to prevent lang yung excess CSF inside the brain. One end of the tubing is usually placed in one of the brain's ventricles like this. Ayan, so you can see the mouse pointer. So, and then the tubing is tunneled under the skin to another part of the body, such as the abdomen or heart chamber, where the excess fluid can be more easily absorbed. People who have hydrocephalus usually need a shunt system for the rest of their lives, and they require regular monitoring. So possible kasi pwedeng excess CSF na yung napupunta sa shunt, de-drain, or minsan pwedeng mahikulang na yung rate ng flow. Yeah, so and the other surgery is the endoscopic third ventriculostomy. Yeah, so you can see here the endoscopic third ventriculostomy is a surgical procedure that can be used for some people. The surgeon uses a small video camera to see inside the brain like this, and the surgeon makes a hole in the bottom of one of the ventricles or between the ventricles to enable cerebrospinal fluid to flow out of the brain. Yan, so naglalagay sila ng hole. Ayan. So, complication of the surgery, of course, hindi naman lahat ng surgery nagsasucceed. So, both surgical procedures can result in complications. Shunt systems can stop draining cerebrospinal fluid or poorly regulate drainage, as explained earlier, due to mechanical problems, blockage or infections, and complications ventriculostomy include bleeding and infections. So any failure requires prompt attention, surgical revisions, or other interventions. Fever or recurrence of the original symptoms of hydrocephalus should prompt an appointment with the doctor. So proper monitoring is needed for the patients undergoing who went under surgery. So for the other treatment, so some people with hydrocephalus, particularly children, might need additional treatment depending on the severity of long-term complications of hydrocephalus. So children's care team might include the following. So pediatrician or physiatrist. So he oversees the treatment plan and medical care. A pediatric neurologist who specializes in the diagnosis and treatment of neurological disorder in children. The occupational therapist or OT for development of everyday skills. Physical or developmental therapist for the development of age-appropriate behavior, social skills, and interpersonal skills. Mental health professionals such as psychologists or psychiatrists, and social worker who assists the family with getting needed services and planning for transition in care. So some children who are in school will likely need special education teachers who address learning disabilities, determine educational needs, and identify needed resources. While adults with more severe complications also might need the services of OT, social worker, and specialists in dementia care and other medical specialists. For the physical therapist, key areas of examination, so when patient is on our care, of course, we take a history of the patient, the head size, rate of head growth, and overall body growth, muscle strength and tone, coordination, posture, age-appropriate motor skills, and sensory abilities such as vision, hearing, and touch. For the prognosis of hydrocephalus, it depends upon the cause and the extent of symptoms and the timeliness of diagnosis and treatment. Some patients show a dramatic improvement with treatment, while others do not. In some instances of normal pressure, hydrocephalus dementia can reverse by shunt replacement. Other symptoms such as headaches may disappear almost immediately if the symptoms are related to elevated pressure. In general, the earlier hydrocephalus is diagnosed, the better the chance for successful treatment. And the longer the symptoms have been present, the less likely it is that treatment will be successful. Unfortunately, there is no way to accurately predict how successful surgery will be for each individual. Some patients will improve dramatically while others will reach a plateau or decline after a few months. So very critical yung early diagnosis kay patients since the more na-diagnose siya early, na-treat agad, so little lang yung magiging magiging maganda yung prognosis niya. So pag na-late, of course, hindi rin maganda. Pero case to case pa rin, depende pa rin yung magiging response ng treatment kay patient. So, yan. So proper monitoring pa rin ang kailangan. So that's all. These are my reference. Thank you very much for listening.